Well, good morning, everybody, and thank you for coming. We are assembled this morning to draw your attention to a hearing this afternoon on Bill C15, which is mandatory minimums for drug offenders. My name is Craig Jones. I'm the Executive Director of the John Howard Society of Canada, which is an organization of 65 frontline delivery service offices across the country that deliver services to released offenders, their families, and children. With me on my left is Tara Lyons from Canadian Students for Sensible Drug Policy, and Richard Eliot from the Canadian HIV/AIDS Legal Network. I should let you say that. I'm just going to give you a brief statement on this, what we regard as the next installment in the Canadianization of the American war on drugs, which is the introduction of mandatory minimums. And I'm going to read to you from the executive summary of my submission to the Standing Committee this afternoon, and then I'll turn it over to Richard and then Tara. We frame this issue in three ways according to how our mission statement works. Our mission statement is effective, just, and humane responses to the causes and consequences of crime. And with that in mind, we break this bill down into these three components. Bill C15 will be ineffective. In fact, it is likely to worsen existing conditions in the illicit drug market because it fundamentally misunderstands the nature of the drug market by presuming that users and traffickers will be deterred by mandatory minimum sentences. A large body of evidence, particularly from the United States, where mandatory minimum sentencing regimes are currently being repealed, contradicts the thrust of Bill C15. American experience further demonstrates that mandatory sentences will have unintended consequences which will exacerbate the conditions that Bill C15 seeks to address. Mandatory minimum sentences will have little effect on drug market crimes because harsh sentences do not address the demand drivers. Mandatory minimum sentences will, however, grow prison populations, as they have in the United States, accelerate the spread of bloodborne disease transmission through needle sharing in prisons, further burden already overextended provincial justice systems, fill to bursting provincial correctional and remand facilities, impose fiscal costs on provincial correctional systems, including legal aid systems, and brutalize those persons already subjected to mandatory minimum sentences. Bill C15 will, if the American experiences teaches us anything, be costly and ineffective with minimal effect on drug market activity. Second, mandatory minimum sentences are unjust. If the American experience is any guide, they will produce unjust sentencing outcomes, unnecessarily adding to the burden of suffering that already characterizes a prison sentence, and thereby making successful reintegration, which is what I'm concerned about, more difficult. The American experience reveals that mandatory minimum sentences for drug market-related crimes fall disproportionately on those persons at the bottom of the drug market hierarchy, while having minimal effect on the so-called kingpins who profit from the economics of drug prohibition. Bill C15 will likely target persons who are already marginalized as a consequence of ethnicity, race, socioeconomic status, mental illness, and addictions. Mandatory minimum sentences have been shown by international experience to produce excessively harsh sentences and have been shown by international experience, mandatory minimum sentences are unjust because they sentence the crime rather than the offender, and that's a distortion of our justice system, while simultaneously shifting discretion to police and prosecutors as criminal justice officials surreptitiously conspire to ameliorate the disproportionately harsh consequences of sentencing regimes they regard as unjust. Third, last, mandatory minimum sentences are inhumane in and of themselves because they destroy the lives of drug users and their families and undermine the integrity of the criminal justice system by imposing ethical burdens on the officials who work in it. Mandatory minimum sentences in the United States are largely responsible for the explosion of that country's prison population, which has led to the consequence of brutalizing many hundreds of thousands of nonviolent offenders, greatly complicating successful reintegration. Sentencing nonviolent offenders to mandatory minimum sentences is, in effect, to condemn them to permanent stigmatization through a criminal record, making them pay for youthful indiscretion or bad luck for the balance of their natural lives. Mandatory sentences will harm the mental and physical health of drug users by exposing them to inhumane conditions of confinement where treatment is rare and inadequate. Typically, the burden of mandatory minimum sentencing will fall hardest on persons predominantly minority, in this case Aboriginal and Black, already disadvantaged by birth, education, place of residence, socioeconomic status, and sheer luck. Thank you. Now I'm going to turn it over to Richard Eliot.
Thank you, Craig. My name is Richard Eliot. I'm the Executive Director of the Canadian HIV/AIDS Legal Network. I have here on the table a copy of our brief and related materials that will be submitted to the Standing Committee on Justice later this afternoon in both English and French. J'invite des questions en français aussi. Why is an HIV and AIDS organization concerned with Bill C15? Mandatory prison sentences for drug offenses is bad public health policy. Craig has already outlined to you a number of the ways in which it makes for bad justice policy. I won't repeat those. But I do want to highlight that it does not make sense to throw yet more people with drug addictions into prisons, which is what Bill C15 will do. We've heard time and again from the government and proponents of this kind of legislation that imposing mandatory minimum sentences, including prison sentences, is about getting tough on crime. It's about getting tough on drug dealers. And at the same time, the claim is made that we're going to show compassion for, quote, the victims, for people with addictions. However, Bill C15 gives the lie to that claim. There is no simplistic division between dealers and people with addictions. In fact, many of those who will be targeted for prosecution and imprisonment under Bill C15 will be people who are on the lower levels of the hierarchy of the drug business, people who engage in low-level, small-scale dealing in order to support their addictions. These are the people who are most easily targeted for law enforcement. These are the people who will bear the brunt of mandatory prison sentences. However, it does not make good sense from a public health perspective to put people with addictions in prisons. We already know that our prisons are filled with people who have a history of substance use. We know, and the government itself admits from its own statistics and its own surveys, that a significant proportion of people who have a history of substance use continue to use drugs while inside prison. Notwithstanding all of the efforts to keep drugs out of prisons, they make their way in. What people who use drugs in prisons don't have easy access to is sterile injection equipment, even though the government's own figures, again, show that people are injecting drugs in prisons. How are they doing it? They're using makeshift rigs that are being shared between many, many different people, rigs that are obviously not sterile, and rigs that pose a risk of transmission of HIV and hepatitis C. To throw yet more people with addictions in prisons while denying those very people access to the health protection tools that they need is bad public health policy. I want to echo what our colleague Craig Jones from the John Howard Society of Canada has said about how mandatory minimum sentences are unjust and ineffective. In fact, the government's own review of mandatory minimum sentences for a variety of criminal offenses has concluded a number of years ago that these sentences are the least effective when it comes to drug offenses. So they don't work. They cost money. They will cost money in particular for provincial prison systems that will be required to house the significant number of people who will now find their way into the prison system as a result of this bill, and it exposes those people to even greater risks of infection with HIV and hepatitis C. And let me just end by noting that the health of prisoners is a matter of public health. The vast majority of people in prisons in Canada will be released from Canada, taking with them whatever diseases they may have acquired in prison. This will be particularly the case for those who spend short periods of time under Bill C15 doing mandatory prison terms in provincial prisons. This is poorly conceived legislation. It's being sold in a misleading fashion to the Canadian public. It will be a waste of taxpayers' dollars, and it will do untold damage to individuals, families, and communities. We urge the government to abandon this legislation, and we urge the opposition parties to vote against it. Thank you. I'll ask my colleague Tara Lyons from the Canadian Students for Sensible Drug Policy to now give some remarks.
Thanks, Richard. My name is Tara Lyons, and I'm the Executive Director of the Canadian Students for Sensible Drug Policy. Today, 23 students and youth from Ottawa, Kingston, Toronto, and Montreal are meeting with MPs on Parliament Hill, urging them to vote no to Bill C-15. As Craig Jones explained, this bill would introduce mandatory minimums for drug offenses, and we are greatly concerned about the impacts such sentences would have on young people